My name is Seemab Hassan, Healthcare Data Analytics Specialist. I've developed 8 flagship projects addressing critical challenges in healthcare integrity, fraud prevention, and patient safety. Today, I present a comprehensive Medicare program integrity and healthcare equity analytics framework that identifies $20.8 to $36.7 billion in annual federal savings, analyzes 3,198 counties covering 29.5 million beneficiaries, and achieves 99.6% model accuracy, delivering a transformative solution to Medicare spending inefficiencies and healthcare access disparities with 461% maximum return on investment. I developed a comprehensive Medicare program integrity and healthcare equity analytics framework addressing dual challenges of spending inefficiencies and access disparities. This data-driven approach analyzes Medicare and Medicaid expenditures exceeding $1.7 trillion annually while 20.4 million beneficiaries lack adequate healthcare access. My innovative Healthcare Equity Index establishes a new national standard for equitable, cost-effective healthcare delivery across America. $20.8 to $36.7 billion annual federal savings identified. 2.5 million high-risk Medicare beneficiaries targeted. 98.4% concordance with federal HRSA designations. 3,198 counties analyzed. Key innovation. Novel Healthcare Equity Index integrating access, quality, and equity metrics with 99.6% machine learning accuracy. Critical findings. 255 high-risk counties with concurrent high costs and poor access generating $2.82 billion excess spending annually. National significance. Directly supports MACRA 2015, Executive Order 13,985 on racial equity, and CMS National Quality Strategy Triple Aim. 3 critical challenges identified. Inefficient resource allocation. 64% variation in Medicare spending from $8,295 to $13,644 per beneficiary. 30% of spending provides no measurable health benefit. Access barriers. 20.4 million beneficiaries lacking adequate primary care. 3,016 counties designated health professional shortage areas. Systemic inequities. 30% higher preventable hospitalizations for minorities. Rural vulnerability scores 20 points higher than urban areas. Geographic concentration reveals 255 high-risk counties requiring immediate intervention. 4 comprehensive federal datasets integrated. Medicare Geographic Variation File. 29,538,265 fee-for-service beneficiaries across 3,198 counties with 247 metrics covering costs, utilization, quality measures. HRSA database. 3,016 counties with HPSA designations and provider-to-population ratios. Area Health Resources File. All 3,240 U.S. counties with 4,300 plus variables covering healthcare facilities and populations. American Community Survey. All counties with demographics, poverty rates, insurance coverage, rural-urban classifications. Temporal Scope 2019-2022 ensuring validated comprehensive analysis. Dual Methodology Framework. Statistical analysis. County benchmarking against national medians. Modified Z-scores for outlier identification greater than 3.5. Pearson correlation for spending access relationships. Multivariate regression with CMS-HCC risk adjustment. Machine learning. Random forest classifier with 100 decision trees. Maximum depth 10 preventing overfitting. 9 key predictive features. 70-30 training validation split. Healthcare Equity Index formula. 30% access score. 30% quality score. 40% equity score, all normalized 0-100 scale for standardized national assessment. Geographic analysis reveals critical patterns. 255 high-risk counties identified with concurrent high costs and poor access. 35% concentration in Southeast region. $2.82 billion annual excess spending in unnecessary costs. County-level assessment enables targeted federal intervention for maximum impact and efficient resource allocation supporting vulnerable populations. State-level grading system implemented. Grade distribution. 2 states achieving Grade A, Utah and Rhode Island. 20 states at Grade C representing 39.2% of nation. 5 states failing with grade F national variation reveals systematic disparities requiring targeted federal intervention. HRSA provides actionable framework for state-level healthcare reform and resource deployment. Exceptional performance validated, 99.6% overall accuracy achieved. Performance metrics: 0.97 precision score, 0.95 recall score, 0.998 ROC AUC score, 98.4% HRSA concordance. Top feature importance: vulnerability score 36.3%, emergency department utilization 24.1%, hospital readmission rate 17.7%, dual eligibility percentage 10.7%, rural-urban classification 5.3%. Production-ready validated methodology for immediate federal deployment. 10-year cumulative impact projections. Conservative scenario: $208 billion savings. Moderate scenario: $265 billion savings. Aggressive scenario: $367 billion savings. ROI range: 178% to 461%. Payback period: 2.2 to 6.3 months. Annual savings potential: $20.80 to $36.7 billion, protecting Medicare trust fund solvency while improving healthcare access for vulnerable populations. Extraordinary taxpayer value across all scenarios. Years 1-2 pilot expansion and Medicare Advantage integration. Technical initiatives: expand HRSA to incorporate Medicare Advantage data covering 48% of beneficiaries, refine disparity analysis to sub-county level census tracts and zip codes, strengthen predictive modeling with chronic disease registries and social determinants of health, begin partnerships with willing MA organizations. Expected outcomes: $5 to $15 billion annual savings projected, 95% or greater risk classification precision, 500,000 beneficiaries improved access. Key milestones: CMS data sharing agreements, FEAR HL7 interoperability standards, HRSA scoring aligned with MACRA MIPS reporting, 5-7% emergency department visit reduction. Years 3-5 national rollout and interagency preparation. Technical initiatives: scale HRSA dashboard nationwide covering all 3,198 U.S. counties, incorporate workforce expansion data with residency placements and National Health Service Corps assignments. Begin Medicaid pilot integration in 5 states. Establish formal interagency coordination with CMS, HRSA, GAO, OIG, DOJ. Expected outcomes: $15 to $26.5 billion annual savings, 10% reduction in preventable hospitalizations, 1,000 new residency slots in shortage areas, 20,000 new clinicians through NHSC doubling. Comprehensive national coverage achieved. Years 5+ cross-program integration and real-time monitoring. Technical initiatives: evolve HRSA into real-time cross-program monitoring system, API integration across Medicare, Medicaid, TRICARE, VA programs, expand to behavioral health and long-term care indicators, implement adaptive machine learning for continuous updating. National impact: $30 to $36.7 billion annual federal savings, 61 million plus beneficiaries covered, 15% emergency department utilization reduction, 1-2-year trust fund extension. Establishes United States as global leader in healthcare equity monitoring. 5 major federal mandates directly supported. MACRA 2015. Expands quality-based reimbursement, introducing validated equity-focused metrics into MIPS scoring. 21st Century Cures Act 2016. Advances interoperability through FHIR HL7 data standards integration. Executive Order 13985. Addresses systemic inequities, identifying 147 counties with greater than 40% minority populations experiencing severe disparities, supporting $2.3 billion targeted investments. CMS Program Integrity Strategic Plan 2022-2026. Provides predictive tools for monitoring financial inefficiencies and access disparities. Payment Integrity Information Act 2019. Reduces improper federal payments through county-level monitoring and evidence-based interventions. Comprehensive Risk Management Framework. Data access delays. Phased partnerships with select MA organizations and long-term CMS agreements mitigating proprietary data complexity. Regulatory oversight. Early FDA engagement restricting HA to population-level monitoring unless approved for clinical use. Infrastructure scaling. FedRAMP certified cloud architecture with elastic scaling supporting 61 million plus beneficiaries. Political transitions. Bipartisan framing around fiscal savings and healthcare equity ensuring policy continuity. Implementation requirements. $150 to $200 million infrastructure investment over 5 years delivering 30-to-1 ROI with HIPAA and CMS protocol compliance. Immediate action required. Medicare spending inefficiencies cost taxpayers billions while millions lack adequate healthcare access. Key achievements. Developed validated framework with 98.4% accuracy identifying healthcare disparities, achieved national scalability covering all 3,198 U.S. counties and 29.5 million beneficiaries, identified $20.8 to $36.7 billion annual federal savings with $367 billion decade projection, created Healthcare Equity Index improving access for 20 million plus underserved Americans, designed comprehensive 3-phase implementation roadmap extending Medicare Trust Fund solvency 1-2 years. Call to action. This flagship initiative represents technical innovation, validated metrics, and strong federal policy alignment transforming healthcare delivery for millions of Americans. Framework is production ready with 99.6% model accuracy and 461% maximum ROI for immediate federal deployment. Protecting healthcare. Advancing equity, serving America.